Hi, my name is Sira Botes. I'm an occupational therapist, a dementia specialist, and a daughter of dementia. And I'm also the owner and founder of Botes Memory Method, where we are providing you hope on the dementia journey. And today I want to talk about a topic that we get a lot of questions about all the time. And that is how to support toileting and personal hygiene in your person living with dementia. How do we support independence? And most of all, how do we prevent infections? So I am going to give you hopefully some tips and tricks that will make your life easier and more effective. I think I want to start with our Memory Bouquet levels and just let you know that for the Lily, which is beginning neurocognitive decline, this person can still follow through with personal hygiene. They should know how to wipe correctly. They should be able to be taught bladder interventions. For example, if there's incontinence, we can teach a person on the Lily journey certain tips and techniques for hydration and how to keep themselves clean, how to wash regularly. And they should be able to follow through, especially if we have visual cues posted in the bathroom. When we get to the Daisy, things becomes a little bit more challenging. However, if we have visual cues posted for the person on the Daisy journey at the toilet, for example, how to wipe from front to back, have a note on the basket for the pull-ups, make sure that the basket is filled with personal hygiene items so that they don't have to look for it. If we have to set up the environment for a person on the Daisy journey, this is mild neurocognitive decline, this person should be able to follow through. However, when they run out of toilet paper, they won't remember to replace the toilet paper, so they may go a couple of days without wiping. If they run out of pull-ups, they may take a soiled pull-up off, but then get frustrated because they cannot find replacement pull-ups. So for this person, as long as they can see it and read it, they should be able to follow through with the next thing, but we have to make sure that they are supplied with what they need. Same with hydration. Hydration is very important for personal hygiene. We need to wash our bladders, flush our bladders clean. So a hydration schedule is super important to keep somebody hydrated, and that has a huge impact on bladder health. When we get to the violet and the rose, this is where somebody's going to need care partner assistance. For the violet, as having somebody on a schedule, reminding them when to go to the toilet next, provide supervision and verbal cues on how to manage clothes, how to wipe correctly, when to change out personal underwear. When we get to the rose level, this person needs physical assistance. They need hand-over-hand assistance to perform a task. For a violet and a violet is moderate neurocognitive decline, a rose is severe neurocognitive decline. We cannot send them to the bathroom or see them going to the bathroom and think that they will execute personal hygiene in a quality manner. It's not going to happen. A violet may recognize the toilet, use the toilet, but you can be sure that they will not be able to follow through with correct wiping techniques. They will not be able to wipe a bowel movement clean, and they are not going to be able to change out soiled underwear the way they should. They need supervision, they need verbal cueing. For a rose, we will now need hand-over-hand assist with a verbal cue as what is to happen next. A toileting schedule is super helpful for your violet and your rose so that they get in the habit of when they're going to the bathroom next. And you will have to take a note on when bowel movements happen so that you make sure that it's actually happening regularly, because you cannot rely on, even on a Daisy, to let you know that bowel movements have actually happened, because they do not have the memory. What I do want, some tips I do want to give you and things to think about is that your Lily should probably be on a regular bathing schedule, which is very important to decrease infections. If you have somebody that's only taking 2 showers a day, which is very common for our senior population, they are at higher risk for infections because they're not washing their bottoms or their perineal area regularly in a way that gets rid of all the bacteria. And if wiping is not happening correctly, and if they're staying in soiled underwear, then they are going to get recurrent urinary tract infections because of the bacteria that lives on the perineum. So I have a very good tip for you, and it's called a bidet. You can go to our website, botesmemorymethod.com, to the Bouquet Marketplace. We're listing different bidets at different price points. You can get them as a deluxe bidet, and that's a couple $100, or a basic bidet. It can be fitted under the toilet seat. It can be hooked up to hot water. And what this allows you to do is to wash the bottom every single time that somebody uses the toilet. So it doesn't matter if they're getting in the shower regularly or not, because we are introducing a wash every time they use the bathroom. And through this technique, we're eliminating any bacteria that may remain on the perineum and that can be wicked into the bladder and cause those infections. And then it's very important to keep that toileting routine. Try to have an every 2-hour schedule. Make sure your environment is set up with exactly what you need: enough toilet paper, enough hygiene products right by the toilet, and then also make sure that your wiping technique is correct. So wiping from front to back. Do not reuse the toilet paper. You wipe once, drop it in the toilet, and then when you're doing the bowel movement, you clean that separately. If you need personal wipes, if you're not quite ready for a bidet, personal wipes is a great way to keep the perineal clean. Make sure you drop that in the trash because it will clog your toilet system. And then again, also make sure when you use those personal wipes, you wipe front to back. Use it for the urinary area, drop it in the wastebasket, and then use a fresh wipe for the bowel movements. So these are a couple tips or tricks to help with personal hygiene and to prevent UTIs. For more information, visit our website where we have a lot of blogs with more information. We also have on our Dementia Learning Center some courses that you can sign up for, and we hope to see you soon.